Welcome to this case study on Social Work Competency 1. This case highlights how a social worker applies Competency 1. Demonstrate ethical and professional behavior while supporting Emily, a new mother in rural Appalachia, experiencing postpartum mental health challenges. The case illustrates ethical decision-making, professional engagement, and adherence to standards of practice in a culturally and geographically rural setting. Background: Emily is a 28-year-old woman living in a rural Appalachian community who recently gave birth to her second child, Noah, now 6 weeks old. She is also the primary caregiver for her 3-year-old daughter, Lily. Emily lives with her partner in an isolated area with limited access to healthcare and mental health services. Her family has lived in the region for generations, and she strongly identifies with Appalachian cultural values such as self-reliance, faith, kinship, and privacy. Presenting concerns. During a routine postpartum checkup at a community health clinic, Emily screened positive for postpartum depression and anxiety. She reported persistent fatigue, tearfulness, feelings of overwhelm, difficulty bonding with her newborn, and intrusive fears about her children's safety. Emily expressed shame and fear about disclosing her struggles, noting that in her community, mothers are expected to manage on their own. She worried that seeking help could lead to stigma or misinterpretation of her parenting abilities. Intervention. Guided by Social Work Core Competency. 2. The social worker engaged Emily using a culturally responsive, strengths-based, and trauma-informed approach. The social worker acknowledged the realities of rural isolation and normalized postpartum mental health challenges, emphasizing that these experiences are common and treatable. Care was taken to use non-judgmental language and to respect Emily's values around family autonomy and privacy. To address access barriers, the social worker collaborated with Emily to identify culturally acceptable and practical supports. These included brief counseling sessions coordinated with pediatric well-child visits, referral to a low-bandwidth telehealth postpartum support group, and connection to a trusted local faith-based maternal outreach program. The social worker also explored Emily's informal support system, including her partner and extended family, while respecting Emily's comfort level with disclosure. Reflect on how culture and rural context affect trust and engagement.